Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. Today, again, Lima Dental Associates with Dr. Wesley Shankland. So good morning.
Good morning, George. How are you?
I'm doing fine, sir. You want to talk about diabetes today. How does that...
I know. You're going to say, how does diabetes jive with dentistry? Well,
exactly.
First of all, George, there are three types, and there are many types of diabetes. There's type 1 that oftentimes children get, that where you make no insulin. Type 2 is where you have trouble with insulin. Type 3 would be gestational, like a lot of women who are pregnant get a certain type of diabetes. But diabetes is an inability to use sugars properly as we metabolize them. You know, sugars are our fuel for our muscles, for our speech, for our thoughts. And if we can't assimilate sugars into the cells in the proper areas, we have a problem with fatigue, being always tired, not being able to think, being in a fog, and a lot of other problems too. And diabetes can be seen, and it's a difficulty for any kind of surgeon, whether one's an oral surgeon or a neurosurgeon. People don't heal well when we do surgery who have diabetes. Mm-hmm. But diabetes can affect the eyes. You know, people can go blind with diabetes. Mm-hmm. It can affect the nerves. You've heard of neuromas or neuralgias, diabetic neuralgias, that cause feet and fingers to hurt. People lose fingers and feet because they have diabetes, and the blood flow is so poor to the extremities that they have to have them amputated.
Now, they mentioned there's some oral health problems associated with diabetes, such as?
Well, these problems, but also one has an enlarged or swollen periodontal disease in the gingiva. The gums get swollen, and the gums get swollen. A lot of bacteria. There's bone loss. The teeth become loose, and you ultimately lose your teeth. And as evidence demonstrates, there's the link between diabetes and periodontal problems. If one has diabetes and gets the periodontal condition cleaned up, the diabetes seems to get better, and vice versa. If they don't get it cleaned up, the diabetes gets worse.
Yeah.
One can also have oral infections because the immune system's compromised. They can have fungal infections, sores in their mouth and in their throat. And also, if they have diabetes, they have a shrinking of gums sometimes. They get a lot of decay on their teeth. Any kind of surgery we do, difficulty in healing. We have post-operative complications with healing and surgery. So the best thing to do is brush well a couple times a day and floss and see your dentist on a regular basis.
That's the important thing. Go visit often.
Often. And maybe sometimes every 3 months instead of every 6 months.